Many thanks for joining us. This is QTV Nightly News and I am Ansmani Esonyasi. And a reminder that you can also join us on Q Radio 103.3 FM. Here are the main news headlines. At the maiden African Chiefs of Defense Staff Summit in Nigeria, which ended yesterday and which was attended by the Gambia's Chief of Defense Staff, Lieutenant General Mamat O.A. Cham, military leaders pledged to reduce Africa's dependence on foreign suppliers and take charge of the continent's security future. The 75th session of the WHO Regional Committee for Africa concluded on Wednesday in Lusaka, Zambia, attended by the health ministers from across the continent, including the Gambia's Minister of Health, Dr. Ahmadulamin Samate. The Gambia Autism Societies launched PAC 2025 to raise awareness of and promote inclusion of persons with autism, marking a key step in strengthening advocacy and support for autism nationwide. And as part of Public Diplomacy Day, the Gambian Embassy in Washington, D.C. opened its doors on Saturday to showcase the nation's culture, traditions, and diplomatic history. Babukar Sow has been elected Speaker of the Children's National Assembly of the Gambia as members convened for the third session and the first ordinary sitting of 2025. Stay tuned as we bring you more on these and other stories. And now here's the news in detail. At the maiden African Chiefs of Defense Staff Summit in Nigeria, which ended yesterday and which was attended by the Gambia's Chief of Defense Staff, Lieutenant General Mamat O.A. Cham, military leaders pledged to reduce Africa's dependence on foreign suppliers and take charge of the continent's security future. Kelechi Emekalam from our media partner CGTN reports.
The three-day meeting wrapped up with calls for stronger regional alliances and practical strategies to confront Africa's security challenges, from terrorism in the Sahel and piracy in the Gulf of Guinea to the many insurgencies that continue to threaten vulnerable states. Defense chiefs said Africa must begin to trust itself to do this and so no longer be dependent on foreign support.
Africa must increasingly look inward, developing indigenous industries, fostering innovation, and strengthening defense economies to reduce dependency and build resilience.
That message came to life at the defense exhibition, where firms unveiled made-in-Africa armored carriers, drones, ballistic gears, and rifles.
Our drones are also being produced here in Nigeria as well. Our vehicles come in as we call it CKD, so we also do that here in Nigeria as well. So most of our productions are actually in our factory here in Nigeria.
Our own production of ammunition will be in December, first one in January with Dicon D7G, 60 million of ammunitions in the year, and Dicon will produce 30 million in the year.
From 1st of September, we start the production of the DG-103, which is an equivalent of the AK-103 rifles.
The displays highlight African innovation in designing equipment suited to local needs. Exhibitors said the next big step is to train operators.
They need a certain amount of training, entry-level, intermediate, ongoing, and advanced training to be able to use the equipment that they buy proficiently.
Africa setting its sight on producing up to 80% of its defense needs locally, cutting costs, saving foreign exchange, and creating jobs. And as the summit ended, the takeaway was clear. Africa's security will no longer be imported. It must be designed, built, and sustained from within. For defense chiefs, Abuja marks only the beginning of that journey. Kelechi Emekalam, CGTN Abuja, Nigeria.
Now, the 75th session of the WHO Regional Committee for Africa concluded on Wednesday in Lusaka, Zambia, attended by the health ministers from across the continent, including the Gambia's Minister of Health, Dr. Ahmadu Lamin Samate. The event was held under the theme Building a Healthier Africa Together. Malnabuka has the rest of that story.
The event, which was held from the 25th to the 27th of August 2025, brought together health ministers and senior officials from 47 member states, among them the Gambia's Minister of Health, Dr. Ahmadu Lamin Samate, to discuss and endorse policies aimed at improving Africa's fragile health system, which continues to face disease outbreaks and many other shortcomings in a challenging financial landscape. The WHO Regional Committee for Africa serves as Africa's highest decision-making body on health, and this annual conference highlights a shared commitment to strengthening health services and improving emergency preparedness for the 1.4 billion people situated across the continent. Throughout the 3 days of the meeting, ministers addressed key health issues including the need to enhance oral health services by 2030, fight chronic blood shortages jeopardizing patients with sickle cell disease, the eradication of malaria, high rates of maternal deaths and the continent's significant health workforce shortage, as well as Africa's health security with plans to enhance early detection and crisis preparedness in the region. One of the highlights of the event, however, was a symbolic health walk participated in by the ministers. The walk demonstrated a united front in the commitment to fostering well-being in the region. Dr. Tedros Adhanom Ghebreyesus, the Director General of the WHO, urged everyone present to use this opportunity and chart a new future for the continent.
We must also confront the structural constraints. Debt service burdens are crowding out social spending, and donor funding often bypasses national systems, making long-term planning almost impossible. And our continent loses more to illicit financial flows and corporate tax exemptions than it gains in aid. Addressing this massive drain of resources requires good governance, strong public accountability, and bold leadership.
Hakainde Hichilema, the President of the Republic of Zambia, encouraged attendees to learn from one another's talents and center collaboration as an approach for developing sustainable solutions.
We need to respond positively and aggressively. It is high time that governments, private sector, WHO, our own health systems work together to drive growth through investment and trading with each other.
Dr. Jean Kaseya, the Director General of the Africa Centers for Disease Control and Prevention, pushed for local manufacturing and highlighted that for health to thrive, there must be a sustained existence of peace.
What we need, and we need to commit that today, is true solidarity and true unity. Our people demand us to come together. Our history demands no less, and our future will forgive nothing less.
Decisions taken during the meeting are expected to set Africa's health agenda for the future, laying the foundations for stronger systems, healthier communities, and a more resilient continent. Mamna Buka, reporting for QTV News.
Now, in a bid to raise greater awareness of and promote inclusion for persons living with autism, the Gambia Autism Society's launched PAC 2025, marking a significant step towards strengthening advocacy and support for autism in the country. Our Bob has more.
PAC 2025 Autism may refer to a range of autism-related resources, including Autism Education Trust World Autism Acceptance Month Educators PAC, the Asia Pacific Autism Conference, among others. Autism is a lifelong neurological condition that typically manifests before the age of 3. It is a developmental disability that affects both verbal and non-verbal communication, social interaction, and behavior, often creating unique challenges for those living with it. In the Gambia, as in many other countries in Africa, autism is often misunderstood, with some communities linking it to witchcraft or believing it is inherited from parents, The recent launch of these packs seeks to provide the tools for those seeking to challenge these misconceptions by raising awareness about autism while providing much-needed support to underprivileged children within the community. Rod Hose, chairman of the Autism Society Gambia, emphasized the crucial role his organization plays in advancing autism awareness and support in the country.
Now, autism is what's considered by many people not even as a disability in some cases, but as a minority disability. To simplify the voices of autistic individuals and their families, and strengthen awareness and build a more inclusive society that takes note of the person who is autistic.
Gas M.M. Jara, the founder of the Gambia Autism Society, expressed concern over the impact on how those with autism are treated in the Gambia.
Our aim is to have a renowned world-class center, autism center in the Gambia, where every Gambian will have access to support from assessment to diagnosis and to any kind of therapy support for OTs or any dietitians, any kind of support needed for them.
Algazim Bah, legal advisor for the Gambia Autism Support and Advocacy Network, highlighted their continued efforts to support and protect children with autism in the country. Jere Kamara, program manager at the Ministry of Health, and Pa Omar Sawane, representing Together for Autism Gambia, both underscored their efforts in supporting people with autism conditions in the Gambia.
Our goals are all the same. That is why we are all here, to sign a memorandum of understanding, to be stronger together. When we come together, we'll come with innovative ideas that will help us reach communities that are more vulnerable.
Autism also found in one of the conditions. That's why we have health promotion continuously at our various community radio stations, and as well as we have health structures that are in the communities that also sensitize people in conditions.
The launch of PAC 2025 underscored a renewed commitment to awareness, advocacy, and inclusion, ensuring persons with autism in the Gambia are supported, empowered, and given equal opportunities to thrive. For QTV News, I am our Bob.
The Gambian Embassy in Washington, D.C. last Saturday opened its doors to showcase the country's culture, tradition, and diplomatic history. The event brought together Americans and Gambians to celebrate a growing partnership. Ali Sise has the rest of that story.
The cultural evening, organized in collaboration with Think to Do DC, attracted over 60 participants, including former U.S. foreign diplomats and their spouses. It featured screenings of short films highlighting the Gambia's sights and sounds, while guests enjoy Gambian cuisine. On behalf of Ambassador Modlamin Ba, Councillor Umi Job Jara welcomed the guests and underlined the importance of cultural diplomacy, showcasing the unique features that make the Gambia an enviable destination.
As you know, the embassy is here for Gambians and Gambian interests. So people-to-people interaction is very important as an embassy, and that's why we're always delighted to host an event that will show Gambia's culture.
Sekou Cisse, first secretary and coordinator of the event at the embassy, praised the United States-Gambia relations, which he said dates back to the 17th century. He said over the years, the people-to-people connections have shaped socio-economic progress and fostered a strong diplomatic partnership.
It has a new democratic dispensation in place, and that makes the country so dear to the United States.
The event left many participants with a deeper appreciation of Gambian culture and the bonds between Banjul and Washington.
Get you guys in the back over here.
In Washington, D.C., public diplomacy through cultural exchanges, outreach programs, and community partnerships is becoming increasingly important, especially in the aftermath of Trump administration's spending cuts, many of which have impacted programs in African countries. Reporting for QTV News, I am Ali Sise.
We will now go for a commercial break, but when we return, we have more national news stories to stay tuned.
Supersonics Islamic Insurance ñooy jël benn digital insurance provider ci Gambia bu ànda sharia ñoo leen isil wécceeku technologie yu xarañ ànd ak dal ba seen bunti kër yi amal nañ leen bépp façon yi insurance service boo soxla pour ngeen mun a am xel bu dal ak kaaraange saa yoo leen ko soxlee su fekkee yaa ngi kër si yoon wala si business ak Supersonic Islamic Insurance Limited ñëwal nga bokk si suñ bànneexi liggéey nga xam fu ñu feetoo oo ñu si +220 5132 319 5132 318 wala 5132 315 wala nga email ñu info@supersonicsinsurance.com wala book nga seetuñu suñ website bi www.supersonicsinsurance.com wala nga seet si ñu Beka Plaza 56 Liberation Avenue Banjul.
Browse Bitus. QCell brings you a promo like never before. Get unlimited internet for just $25 Cs. Yes! Recharge $25 Cs and enjoy the convenience of free internet from 1 a.m. to 6 a.m. every day with our Browse with Us promo. With this amazing offer, you can browse, stream, and download all your favorite movies for free. So why wait? Recharge $25 Cs today and enjoy free internet only with QCell between 1 a.m. to 6 a.m. For more information, call customer care on 111. QCell, Senior Bus. We innovate, others follow. Terms and conditions apply.
Welcome back from the commercial break. We remind that you're watching QTV News coming to you from our studios on Caraba Avenue. Now, Babukar Sow has been elected Speaker of the Children's National Assembly of the Gambia, securing the highest number of votes, 69, as the 105-member assembly convened for its third session and the first ordinary session of 2025 rather. Yafatoge reports.
This year's sitting holds special significance as members work to renew their leadership, strengthen advocacy and present a petition paper titled Working with Children to Build a Better Gambia. The paper highlights the challenges children face in exercising their rights and is expected to call on the government, civil society and development partners to take stronger action on issues affecting Gambian children. Babukar Sow, the newly elected Speaker, thanked members for his nomination and election and called on everyone to work together to promote child welfare in the Gambia.
It's a great honor to be elected as Speaker of the National Assembly. Although with a greater responsibility, of course, I am aware. Honorable members, I just want to pray to Allah that I shall successfully travel the path successfully and responsive to the wishes and aspirations of the children of this great country of ours, the Gambia.
Alaji Jaju, representing the Minister of Youth and Sports, also highlighted the importance of and key role played by the Children's National Assembly.
Honorable members, your voices matter, your questions matter, and your ideas equally matter. As policymakers, we are reminded that we cannot build the Gambia we want if we fail to listen to the voices of our dear children.
Since its establishment, the National Assembly has consistently championed children's voices on critical issues such as child marriage, child labor, access to education, healthcare, and protection from abuse and exploitation. By electing a new leadership, members hope their concerns will be heard and their rights safeguarded, particularly against harmful practices like female genital mutilation and child marriage, which continue despite official bans. Ms. Nafisa Binti Shafiq, UNICEF country representative, emphasized the importance of ensuring that children's voices are heard and properly guided.
Today, let us affirm every child of the Gambia must be embraced with justice, with opportunities, and with dignity.
Ilo Jalo represented the Minister of Gender, Children and Social Welfare.
This assembly is a living testimony to our national commitment to promote children's voices, strengthen child participation, and uphold the principles of democracy, equality, and inclusiveness.
The Assembly believes children are active participants, not passive recipients in shaping policies. Through debates, elections, and resolutions, members are redefining children's role in national development. The Children's National Assembly is a powerful platform for young people in the Gambia, giving them space and legitimacy to address issues affecting their lives. For many members, CNAG is both a voice and a safeguard to ensure children's rights are taken seriously nationally. Reporting for QTV News, this is Yafat Gay.
Now, the Ministry of Health has commenced a 3-day training program on environmental surveillance for polio, aimed at equipping stakeholders with the skills to detect the virus early and strengthen national response mechanisms. The program is supported by the World Health Organization Gambia office. Mamna Bukar tells us more.
Despite being certified free of indigenous wild polio virus in 2004, the Gambia continues its vigilance against polio resurgence, following the detection of circulating vaccine-derived poliovirus type 2 in 2021 and 2024, through an environmental surveillance where samples were collected and studied from sewage systems in Banjul, the dump site for septic tanks in Kotu, and the drainage system along Talinding Darussalam. According to WHO, polio is a highly contagious viral disease that primarily affects children under the age of 5. It spreads mainly through the fecal-oral route and can lead to paralysis by attacking the nervous system, potentially resulting in death. This capacity-building workshop aims to evaluate the underperforming aspects of the Gambia's environmental surveillance system and develop effective solutions, as well as provide training for sample collectors and supervisors on the correct methodologies for environmental surveillance to detect the presence of poliovirus. This approach is deemed essential for the early identification of potential outbreaks and facilitates timely public health interventions. Ibrahim Toure, the Deputy Director of Public Health Services, stated that this is part of the country's efforts to maintain a polio-free status.
This training is timely. I urge all of you to take it seriously and ask questions. And then we hope at the end of the training, you'll be able to implement what you've learned during the course of these 3 days.
Dr. Selassie Ahmad Almeida, the Health Policy Advisor of WHO, reaffirmed the organization's commitment to support the Gambia in strengthening surveillance capacities.
Through our collaboration with the Ministry of Health, we aim to enhance laboratory networks, improve data systems, and promote cross-sectoral coordination. We are also working to ensure that environmental surveillance contributes meaningfully to achieving universal health coverage and sustainable development goals, particularly SDG 3 on health and well-being.
Benjai, a participant and also the Deputy Program Manager of the expanded program on immunization under the Ministry of Health, sheds light on some of the outcomes they hope to achieve by the end of the training.
They go to areas where it's highly contagious. Feces are there and all those things. The protection that they need, we need to train them on the proper way of putting on the protective clothing, how they protect themselves when they are collecting sample, and how they package the sample, and then also from the sample collection site to the National Public Health Laboratory, and then how we also package it from the National Public Health Laboratory to our international lab in Dhaka, where we send the samples for analysis.
The workshop forms part of a wider initiative to ensure that the Gambia remains vigilant against potential public health threats. Mamna Buka, reporting for QTV News.
Now, more than 20 journalists are participating in a 3-day training on physical and online safety on Wednesday, organized by the Gambia Press Union with support from the National Endowment for Democracy. Momodo Gajaga has the details.
The training covers both physical safety, preparing journalists for tense situations such as protest, political coverage and disputes, and online safety, focusing on securing their devices to protect themselves and their sources. The sessions addressed internet security, safeguarding personal information, the use of strong passwords, and protection against malware and phishing. They also explored what constitutes harassment and the available reporting mechanisms, among other key topics. Halimatu Sise, the editor of Seatail Media, and Yankuba Jallo, a senior reporter at Forea newspaper, are participants who shared their thoughts about the training.
Yeah, the training is very fundamental, especially now that we are heading as a country to a new electoral cycle, where we expect that the situation is going to be tense, even against the journalists, because we are going to have, whatever we write as journalists, whatever we say or do, it always have impact on the society. So every corner, every person is interested in what we do. This is why sometimes, you should not only stop at physical, knowing our security, but also online, because it's always risky to put up information, because all we deal with every day as journalists is information. So if we don't know how to keep it secure, then we'll be in trouble.
So this training equips us with skills like how to protect ourselves in case of violence, when violence erupted, and there is tear gas, or there are situations where the people that are involved they are throwing stones, or they are doing things that can harm us as journalists.
Paul Steven Pereira, a trainer on physical safety for journalists, shares some useful tips, especially when covering protests which could turn violent.
You cannot be in between the police and the people protesting as a media personnel. So this situation change. Where are you? You are in the middle of the thing. The police will not have that time to allow you to park. All what they have to do is to make sure that they disperse people. An order is already given, and that order must be executed. The protesters will be running after their life. All they want to do is to pick stones or grab whatever that is around them to throw back to the police that are coming towards them. So you are in the middle of the thing. What you do in that particular situation, you stand aside.
The training will also equip journalists with skills in risk assessment, physical safety and security protocols, safety measures for field assignments, situational awareness, safety planning, and contingency preparedness. Mamadou Gajaga, QTV News.
And I'm afraid this is where we draw the curtains on this bulletin, but do join us at 10 p.m. for another bulletin. Until then, thanks for watching.